My name's Zach. I'm with Mizuho, and this is your Hana table. Before I get started, has anyone or everyone, or how many hands have seen this in action, or at least used it? Everyone? Okay, perfect. So, if anyone comes to the head of the bed, I'm going to go over troubleshooting down here and just what some of this stuff means, and then I'll walk down throughout the whole bed. So, first things is you always want to make sure the table is plugged in and turned on at all times. So whether you're in surgery or it's in storage, always plugged in and turned on. So I was happy to see that that was the case here. And then second is making sure all the wheels are locked once the patient is, before the patient gets in the room, before you transfer them on, you want this table locked. How you do that is it's manual, all four wheels. That's unlocked now, so to lock it, you just push down, and then to unlock it, you can just kick it. It's not fragile or anything, so you just kick it as hard as you want. And next is you got 3 stickers on here. One is stating never to move the table while there's a patient on it, just a reminder. And then the second red label is the weight capacity, which is 450 pounds. Then your third label would be your manufacturing label. That's just giving you information about the table, so the date, the company, we have a service number on there, so if something happens to the table and you need to get a hold of us really quick, there's a number on there you can call. And it also gives you the serial number and all that information. So you'll have everything you need when you do make a call if you need to call us. All right, before I go further, is there any questions? All right, so for troubleshooting, there's 3 different things. One is if you're doing in a case and there's 3 fuses down here and the table stops working, what might have happened is one of these fuses will pop out. What happens if you girls want to see, there's a white little square that comes out and that will kill the whole table. That will only happen if something internally happens to the table. So you'll see one of these 3 fuses and it'll come out like that. So right now the table's dead. Now, something is internally wrong, but if it's during a case, of course you need the table to work. So just push it back in and the table will work. Only thing is after you do that, you want to call service, even me, anyone who can take a look at the inside of the table, because even though it still worked after you pushed it in, there's something internally wrong, so you need someone to take a look. Second is a kill switch. So I've never seen it happen, but if you're in a case and the table starts moving, you're not hitting the hand pendant, and you want to kill the table, there's a red switch right there, you can just push it in. Now, sometimes when you're setting the table up, someone might have their foot up here to lean over and might hit it. So if the table's not working, there's no fuses popped out, just check that kill switch, turn it to the right, and the table will work in seconds. All right, those are the 2. And then the third is if there's no fuses popped out, kill switch isn't pushed in, I would just shut the table off, unplug it, wait like 30 seconds to a minute, like computer, phone, and plug it back in, turn on. If it doesn't work after that, then you definitely need to call us, and we'll get a service engineer out. All right, so those are the 3 troubleshooting issues. Anyone have any questions before I move forward? All right, so I'll go over more of these buttons in a little bit, but you got your hand pendant here, you got your up, down, tilt left and right, and then Trendelenburg and reverse Trendelenburg. Now, if we tilt it to the right, and you want to bring it back to level, it's this blue button here. You just hold that down, and it will go back to level. Now, even if it delays a little bit, you want to make sure, you want to hold it even a couple seconds after, just to make sure it's fully level. Sometimes it delays a little bit, so just want to do that. Now, if this breaks, it's not available, lost, whatever, there is a backup right here with all the same controls. So if you're in a rush, no need to worry about that. You have a second backup right there. And then with these 4 lights on the side, that red light should always be blank like that. That means it's charged, everything's good. And then these 2 green lights should be on. Now, if that red light, if you plug it in, turn it on, it starts blinking like crazy, it's not getting a full charge. So I'd try different outlet. Sometimes people plug it into like some dangling, one of those jacks, and it doesn't work. So always a wall outlet will work. And then I'll go over these buttons in a little bit. It has to do with more on the front of the table, but this is your head end, and then under each side, you got your arm bars. Excuse me, let's get the arm boards over here. So each side, this big knob here will lock the whole arm in. So when you turn it, it's locked in. Now, before I go forward, with all these knobs on here, everything, you don't need to tighten anything too tight. It'll actually end up stripping the bolt. as you keep doing it, and then you're gonna have to replace some of the screws. So what I did there is just enough, and then you can move it. Good, it's all set. Then you got this block that you can still move. To lock it in place is the smaller screw right here. And then you can see that that's locked in, great. And you can just put your arm board in, which would be this third and final one. Okay, pull it out more. And you can see if you look in that hole, if there's enough room to get this in. So you can push it in as far down, as high as you want. And then this last screw, just turn it until you feel it's tight enough. Perfect, everything's all good. All right, any questions about that area? All good? All right. And I'll go over the femur lift after, but going down the table, your perioneal post, and then your 2 leg spars. So the first is your gross traction. Right now they're both locked, but to unlock it, as you can see, turn left, and you go all the way up and down the railing. Now, it's a red zone. That means that's a warning that you're running out of railing. So if you started the case down here and this traction pulled, or if you go down when the leg gets pulled back, there's no more room. So you always want to start the case somewhere in the middle. Sometimes surgeons like to start it pretty close, but always start in the middle, never in the red zone. Then you get your fine traction up here. This is usually used just to give more length, so obviously that's the furthest it goes. But I'm not sure if you guys have extenders. They might be on the cart, but we do, if you have a really short patient and you move this up a little bit and the fine traction's all the way out, we have another extender that can go on there. So it just extends it more if you have a much shorter patient. But yeah, that's your gross traction, your fine traction up here. And then you got your degrees here. So we're gonna say the right side. So surgery's on the right, and at some point the surgeon is gonna ask external rotation, say 90 degrees. Unlock this, and then you just turn it 90 degrees external, and then lock it in. With communication with the surgeon, it's always important to, once they let you know what they need you to do, to repeat it back and then talk through it. So 90 degrees is locked. Good. So always communication is key with surgeons. Some of them use different words, but I'd always just speak with your surgeon before, get comfortable with what they use, comfortable with how the procedure goes, and then you'll be able to get through it very smoothly. Now, always start the surgery at 0, because as I mentioned, when he asks you, or they ask you to rotate the leg, you want to make sure you can easily do it to 90, where if it starts at 20, then you have to do the math, which isn't hard, but you don't want to have to, go back and forth. So always keeping it at 0. Any questions so far? Okay, so this is for the boot holders. So right here, this knob's just early maneuver. It's only, I don't know if you guys do any lateral position. Mm-hmm. Yeah, so this is usually just going to stay at that position. That's just, boot goes right in there. Only time you have to do, like I said, if you do lateral position, just to maneuver the boot or the ankle. And this last knob is for the boot. So when it comes to your boots, I'm not sure if you have all 3 sizes, but it does say on here, it comes as small, large, and extra large. And of course, left and right. So we got a small left boot here. I'll do the right one. And then, are these aligners you guys use for every case, the same ones? Mm-hmm. Okay. One thing about these liners is they can't be cleaned properly. There's no IFU for it. The way the padding is, any bodily fluid seeps in there and you can't clean it out. Even if you use any type of wipe, the strongest cleaner. So we have a kit that you can use disposable ones. You can keep reordering these, but we always recommend to switch these out. I don't like to use more than one case. They say 6 months is the maximum, but I would switch these out a lot. Obviously, if someone has an infection on their toe, touches up here, and then someone else comes in, touches that, gets infected, obviously that's not the best or good at all. So, but when it comes to putting the boots in, again, this knob right here, nothing in the way, perfect. Push it right in, and then you just turn that until you feel that it's locked into place. And then with these knobs, you just push it in, and then you can keep pushing and it'll go, but you can always just use these to just crank it as hard as you want. Usually you want to do it pretty tight just so that foot doesn't come out when you pull traction. And then to undo the boot, you just push that way. That comes right out. All right. Any questions on the boots? Any of that? All right. Now I'm gonna go with the femur lift, and then I can go over the type of movements during hip surgeries. So femur lift. This femur lift goes right into this slot, but before you do that, you want to plug it in. So there's 2 wires. They're both stored right under here. It's a little hard to see unless you come under here, but there's these little black holders that where you put in the wire, and then it comes out like that. So red dot on here, red dot on here, match those up. And when you do match it up, it goes in nice and easy. And then you plug it, push it right in here. Now, you can go as far as you want or as far back as you want, depending on the surgeon's preference, but to lock that in is just this knob right here, and then it's locked in. Now, this is when it comes to the sterile parts on the table. This doesn't need to be sterilized, and not sure if you have it in the room, but there's 3 different components on here. There's one extender, then there's a bracket with about 6 to 8 holes on it, and it has hooks that you put into it when it opens the patient's hip up, so the surgeon it's opened up, surgeon can do what he needs to do, and you obviously don't need someone there holding hooks to hold the hip open. So it's mainly used for, and those hooks and the bracket and the extender need to be sterilized. Everything else on here just needs to be cleaned normally. So we got patient on the table, that's in, get the bracket in, things ready. So it's during the case, and the surgeons will ask, say, down and over. So to unlock the spar, push it all the way. And the good thing about these tables is they actually added this hydraulic system to where the leg won't drop. Not that you guys really need to know, but our old tables didn't have that, so I'm glad you guys do. Now, down and over, you go down and over, that's about the speed. This will be raised higher, but that's about where it will go, and you can lock it in, and that's when the surgeon is gonna have, he's gonna maybe want to do it for 10 minutes, 15, whatever way he wants to. Now, one thing I did wrong. Can anyone tell me what I did wrong? I didn't unlock the gross traction. This will be unlocked. I've seen surgeons have it locked 90% of the case. I had some surgeons not locked a ton.
You never lock them.
Good. Because when you do lock it and you go down, this is gonna get pulled up. And if you keep going, there's no rear end, you're gonna be pulling the patient off the table. So, always, as you said, I'd rather have them unlocked the whole time because this is me moving a lot. But if you ever want it locked, you just lock like that. But again, don't start in the red zone. So when this goes down like this is gonna end up getting pulled up. And then when you move it over, it's gonna get pulled up even more. So it can be in the red zone when you're in this position, but always keep an eye on it. And maybe even if it gets like there, just let the surgeon know we're getting in the red zone. So you can kind of maybe adjust what he needs to do or adjust what you need to do. But always have that gross traction locked most of the time. And he'll let you know. You can always say, would you like it locked? Yes, no. So in storage, I always have these locked, but yeah, during case, have those unlocked. And to lock the spars in place, just go right back. You don't need to go all the way, just 11 or 12 o'clock. Going all the way again will strip the bolt like any other screw on here. Is there any questions? All right, and again, I didn't do it the first time, but always, like you said, make sure it's unlocked. It's probably the most important thing. Repeat back to the doctor it's unlocked. Just double check it every time, and you'll be all set. Now take the boot off. Do you ever take the spars off the table? The leg?
No.
You don't? Okay. So there's 2 places those leg spars can live. Now, if you don't take them off the table, that's great. We'd rather not take them off the table. If you need to, they have to go in the cart. So it's either the cart or the table. So if you just leave them on here, everything's fine. For storage, if you want to just leave these on, unlock these. And what you can do, it doesn't do a lot like a ton more, but you can always like raise these as high, raise the table, raise these high, and then kind of just, you can see a little more room, but. And if you have the cart, you can always store the cart under there as well. So if you raise these, you put the cart under there. And then, so if, yeah, if you don't have anything else to store, I mean, this room's plenty big for 2 of them, so you're all set. The cart though, it does have places for all the parts to live. So it has place for the arm boards, the boots, the spars, every accessory. There's a part on the cart. So just like to make sure you guys have that, but if you don't, something to explore in the future, or if you guys, if it's working great, maybe you don't need it. All right, so I'm not gonna go over how to take these off, unless would you like me to show, just in case, or?
I mean, you could quickly, but we're never.
All right. Well, I'll take these off. Actually, I'll leave this on because this was on before I came in. But I have one more thing I wanted to go over. This is what I was mentioning when I said disposable boot liners.
Our surgeon won't use them, so don't even bother.
But there is one thing in here I really would like to see everyone use.
Oh, Kelly! I don't know, I never asked him.
So, I'm okay with the surgeon not using the headrests, the arm boards, boot liners. If they really want to use these, I would just recommend to order more of those. But there's the boot liners, the headrest, arm boards. These are what I would say you need to get. Now, if you buy one of these kits, you can customize it, so you can just get one of these. Like, just these in like a
We do use
case of,
those.
like,
We use
you do?
those.
Okay.
Yes.
Do you know how it goes on and everything?
And the cover for the
Just make sure when you put it on, it goes over all the joints. It doesn't need to cover any of this. It's just for this area because this can't be cleaned. And if you don't cover it and you get bodily fluids in it over time, this is gonna stop working. One of these legs is about 30 grand, and it's not a part of the table where a service engineer can come in and kind of just repair it. It's gonna have to be replaced. So whatever you're gonna use to cover those, keep using it, because that's all of our opinions, that's definitely the most important part of the table. Again, we like to see everyone use all this, but these are made for the Hana table. Now, they don't, surgeons want to use those liners, it's fine. One little thing is if they end up wanting to use these, I'll just leave this pack here in case the surgeon wants to try it out. There's these lines right here that you can actually tear. So, these obviously are bigger. So if you just have trouble getting it in the boot, or if you have a smaller patient, you can always tear these. Kind of see, tear all along the edges, and then it would fit easier. And I can try to be here for the next case, if that's comfortable for everyone to see just how it works. Like I can, as a surgeon's going over it, I can move the table and talk them through it, how it works. If someone wants to see it in surgery, or
How short notice could you be here? Because right now we have a nurse that's kind of facilitating, but
Yeah, I
if
mean,
he couldn't be available.
like 2 or 3 days.
Okay.
Yeah.
Good to know.
Just 2 or 3 days before, and I can make plans to get up here. One other thing you guys had was a strap. Now, I've seen 100 different ways they strap the patient down. Some don't use this, but if you do use this, now, if you use this and you go under this way, make sure you above the spars. Obviously, the spars will be getting moved during the case, so if you did it under there, this is getting pulled, and it'll be pulling on the patient. And then you can kind of pull back here this way so the hip's still open. And I have had some pushback on this one just because, some it might be in the way a little bit. Can always, if you feel more comfortable, you can always go from the back. I've seen it happen, it's fine. It's just, you don't want the table getting moved and this trapping under there. So I always go to the front, but and then I've seen other surgeons just do it their own way, and I'm not gonna get away with that. I mean, if they want to use this, awesome. You don't have one scheduled yet, though, for cases?
Well, it's every Friday.
Okay.
But as I said, our striker rep was moving the table. and then
Yeah,
now
those striker reps are experts on this.
yeah,
Yeah.
you should hire them.
Yeah, well, it's great because we get our companies get along so well because every time I go in for a case, there's a striker rep there. We meet and then we start working together, and
Yeah.
it's great. I mean, they call us competitors, but we really, I don't really.
Symbiotic, right?
Yeah, they do the implants, we do the table, all works out perfect.
Right.
Any questions? Are any of you girls gonna be in the next case?
I don't know.
Okay.
It's a surprise, but everyone
Not me.
goes
It's
through
not
those
so much-
rooms.
It's not so much the table that we struggle with, it's knowing what the settings are, like knowing, needing to know that if he's in an AP, we're doing 40-40. External rotation on both.
Yeah,
It's those
exactly. Yeah,
things,
exactly.
Like he
Yeah.
doesn't
That we
always communicate them.
right, that we struggle with, like, or knowing like when the hook is in the hip,
Is that how
We're
we'll talk to
down
him?
into the
He'll say
side.
like external rotation. Does he use those?
sometimes.
Because like, so like last case, I spoke with the doctor before and I said, let's go over like just even the vocab. Like, what are you gonna use for this? And then he just told me the whole procedure. So he's like, we're gonna do both like I said, rotate both legs to kind of match, you know, the other hip. But he's like, yeah. He goes, I'll just talk you through it. Just repeat back to me. It's very easy if you talk to your surgeon before and kind of just get some of the verbiage down. Like, we're gonna rotate the foot. We're gonna pull traction. We're going down and over. Yes, yes. Okay, great. And then just let me know and I'll repeat it back. Perfect. I had one surgeon who was a little mumbly, so at one hospital where you couldn't understand too well. So if you can't, speak up and just say, I'm sorry, I couldn't hear you, or yeah. So there's a lot going on during the case. Sometimes you might be talking to the X-ray and say something that you might think is yours. So just always repeat back and make sure you got everything you need. And I'll keep these unlocked because they already were. Yeah, and again, you don't need to tighten anything too tight on any of these bolts. So. All right.
Thank you.
Yeah, and I can send over some more info, like paper setups of the table, just Hana information. So if anyone needs to take a look, or last second new staff comes in and needs to check it out real
We
quick.
wouldn't throw them in there. Emily, except for you.
Got it.
You don't know if we have the extenders for the.
I don't think we do, but I think it's for
It's
like
supposed to
under
come with the table.
what size?
It should. Oh, but that's like someone who's like 4'8".
Yeah, it's not something we would do here.
Yeah. We did have, well, that case of this girl was 4'9". They didn't need the extenders, so that was like, all right, she doesn't need them. So.
Never pull the post until you're ready to move the patient.
Yeah, so before the patient is on the table, some surgeons will leave it in. I guess it depends if you're transferring on that side, they can just leave that in, but always the post coming off. And then when you transfer the patient on, the surgeon usually, I don't know if it's different at a lot of hospitals, but usually what I see is the surgeon already putting the boots on the patient before they on the table.
Before we move on.
So say this is the table that you're transferring from, you 1, 2, 3, and the surgeon will be the ones with the boots, and then he'll be the one locking everything in. He'll probably move the fine traction to get more length, and then he's gonna want to move this. Just always keep an eye. Sometimes they don't pay attention to the red zone, so just let them know. Oh, it's in the red zone. Is that
Yeah.
is that okay? And then again, right when they're on in position, make sure you get this in. We also have another product called a Hana distraction pad that you put under the patient on the transfer table, and then there's actually areas where you can grab the table like these, and you can easily get the patient on.
Oh, like a hover mat?
Yeah, and then you leave that on during the case, and they won't slide. If there's a case, obviously it's not supposed to slide, but it just keeps, just an extra precaution. Hana Post is supposed to be, works every time, but distraction pad's an extra level of precaution if the surgeon gets worried about slide. If he gets patients that slide a lot, we have that pad. It's like, kind of like this material, kind of, so it doesn't slide as much. Yeah, and I'll leave this if you guys see that and you're like, oh, we need some arm rests.
Thank you.
Yeah.
Thank you.
One thing is this. This is the foot pedal. this is for that femur lift. So, usually goes right here. Now there's an area right there, and it shows it has a picture of the foot pedal, and then it has the unlock and lock. So if you line it up at the unlock position, all you have to do is turn it, and you can hear the click. And when that's locked in, that moves the femur lift. Now that's usually the surgeon who will be doing all that, so you really don't need to worry about that. But if you came back here on the left, you can see that's telling you that it's on the right side of the femur lift, and that the foot pedal and the femur lift are plugged in. So there's lights back here that will show you what's plugged in. And then again, the last thing I want to go over is it says right femur lift and left femur lift. Obviously we're doing the right side, so make sure it's flipped to that side. I got a call where they had to flip to the other side and it wasn't working because it just was on the wrong side. So some simple things that you just might need to do to get the table to start working correctly. But yeah, you got left and right there, and then again, surgeon will be usually using the foot lift. So, but if you ever need to set it up, it's a pretty simple setup. All right. Well, there's a couple things I jumped around a little bit, but is there any questions? Is there any things I need to go over again that are confusing? All right.
Good, thank you.
Did you want to put
Thank you.
everything back on there, or?